Hey guys, today we're going to talk about adjustment disorder, a mental health condition that can emerge following a significant stressor in an individual's life. Understanding this disorder is crucial for mental health professionals as it helps ensure accurate diagnosis and effective treatment planning. I'll cover the key factors defining adjustment disorder, the diagnostic features that set it apart from other trauma and stressor related disorders, and the importance of using specifiers and modifiers in this diagnosis. Let's start with a clear definition of adjustment disorder. According to the DSM-5 TR, adjustment disorder is characterized by the development of emotional or behavioral symptoms within 3 months of experiencing a specific stressor. These symptoms can manifest in various ways, including anxiety, depression, or difficulties in interpersonal relationships. The key factor here is that the symptoms must be disproportionate to the severity of the stressor and/or must cause significant impairment in social, occupational, or other important areas of functioning. The video Adjustment Disorder DSM-5 Diagnosis and Treatment by JJ Medicine in 2018 that I found on YouTube defined adjustment disorder as situational depression, which I thought was interesting. Basically, it said if the stressor is removed, then their condition should improve. So the stressor is causing the problem rather than some other trauma or stress-related disorder. For instance, let's consider somebody who recently lost their job. This change can certainly be stressful and traumatic, but not everyone will develop PTSD, which requires exposure to a life-threatening event and involves symptoms such as intrusive memories, hypervigilance, and avoidance behaviors. Instead, a person might develop adjustment disorder if their emotional response to the job loss leads to anxiety and depression that disrupts their daily life, but it does not fit the criteria of PTSD. Another crucial aspect is that adjustment disorder can occur in response to a variety of stressors. This can include situations like a relationship breakup, the death of a loved one, or even positive changes like moving or starting a new job. The key difference lies in how the individual copes with these stressors. If their reaction is excessive and impacts their functioning, then adjustment disorder may be the appropriate diagnosis. Now, let's talk about the importance of specifiers and modifiers when diagnosing adjustment disorder. Specifiers include and provide essential information about the nature of the symptoms. For example, in adjustment disorder, a clinician can specify whether the predominant symptoms are related to anxiety, depression, or a combination of both. This is especially important because it will help guide treatment. For instance, if the predominant feature is anxiety, a clinician may focus on cognitive behavioral strategies to address those anxious thoughts and behaviors. Modifiers also play a crucial role in understanding the timing and context of the stressor. The DSM-5 TR distinguishes between acute and chronic adjustment disorders. An acute diagnosis applies when the symptoms last for less than 6 months. A chronic adjustment disorder diagnosis applies when symptoms persist for more than 6 months. This distinction is significant because it can influence treatment duration and intensity. For example, someone with chronic adjustment disorder may require more comprehensive therapeutic interventions compared to someone whose symptoms are acute. So obviously longer term treatment is required if you have chronic. Shorter term treatment is probably required if you have acute adjustment disorders. So using the correct specifiers and modifiers helps avoid misdiagnoses and ensures that individuals receive the right type of support. The nuanced understanding of a person's experience enables clinicians to create tailored treatment plans that address the specific symptoms and challenges of that individual. So, in conclusion, accurately diagnosing adjustment disorder requires careful consideration of the individual's symptoms, the nature of the stressor, and its impact on their functioning. By understanding the key factors defining adjustment disorder and employing the appropriate specifiers and modifiers, mental health professionals like us can develop more